Hello, good afternoon. My name is Justin Keilman, and today I will be talking to you about muscular dystrophy and exercise, and how we can create a safe and effective exercise program, and how exercise can help mobility, health, and independence for every individual that has it. Okay, introduction. As you can see on the left, that is a young man who has muscular dystrophy, and it is affecting every single part of his body. Things we will cover today: what muscular dystrophy is, how it affects the body, how to exercise safely, and we will also discuss medications, researches, and a sample exercise plan that can give us safe exercise, and that is the key to a long-term good quality of life. Alright, first let's go over what muscular dystrophy is. It is a group of genetic disorders causing progressive muscle weakness. In an article that I referenced by Mayo Clinic, it is a group of diseases that causes progressive weaknesses and a loss of muscle mass. That is the definition. It affects everything like our daily activities like walking, lifting, and climbing stairs, things that most people do in their everyday life that don't even think about it. Some cases may start in childhood, others start later in life. Treatments can help manage symptoms and slow the course of the disease. Over to our right, we can see some symptoms. Some are facial muscle weakness, cognitive difficulties, muscle weakness, fatigue, muscle and joint pain or stiffness, speech and swallowing problems, or mobility and walking problems. Alright, types of muscular dystrophy and epidemiology. Duchenne muscular dystrophy is the most common form, mostly in males and often early on in childhood. Becker muscular dystrophy is less severe and is slower progression. There are other rare types of it like limb-girdle and myotonic. And as if it's in your genes, as always, risk increases with family history, no matter your age. It can start when you're early or it can start when you're later. It does not discriminate. Duchenne affects around 1 in 3,500 to 5,000 males during birth. And then early diagnosis helps plan care and exercise. So if you get on it early, you have a much better chance. Over to our right, there is a chart with the difference between Duchenne and Becker. Often there's incidences with Duchenne 1/3 or 600 mile bursts. Usually you get it around 3 to 5 years old, and it progresses very fast. And then since it is progressing fast, our only life expectancy is around like your mid-20s. Second, Becker, you usually get it around 12 years old, and you have a longer life expectancy, which is 40, and you're much more functional, and it doesn't creep up as fast, and it's slow progression. And then, it affects around 3 to 6 out of 100,000 males during birth. Alright, how it affects the body. It often affects the mutations affect protein for strong muscles, mainly dystrophin. Mayo Clinic says that it interferes with the production of proteins needed to form healthy muscles. Muscle fibers weaken and are replaced by fat and connective tissue, and damaged muscles cannot repair effectively, so they just stay that way, leading to progressive weakness. They usually get worse, it's not reversible. Over time, even simple daily activities become difficult. As you can see, this is a man who has muscular dystrophy, and he is having trouble opening a cabinet. He has some sort of therapist or family member or something along those lines helping him do his normal tasks that we do every day and don't even think about it, especially opening a cabinet. Alright, let's go back to symptoms. There is often weaknesses that starts in the hips, shoulders, and legs, so like main body part movements, and you usually have difficulty standing, climbing stairs, or lifting objects, or like we just saw, like literally things like opening a drawer, moving a frame, putting on it doesn't matter. And then there's frequent falls, trouble running, or trouble getting up from a chair, and advanced problems are like breathing problems, heart issues, and like you're going to need a wheelchair for many of them. Some symptoms often start subtly and then Early intervention maintains function. You can get on it. It'll slowly get worse, but it won't get as worse as quick. So if you get on it quicker, they can give you a plan of action to give you a better chance at going around your daily life better. And then some experience joint contractures or scoliosis, which is curvature of the spine. And Mayo Clinic has muscle weakness that becomes worse and worse over time. Over there, you can see some more symptoms. I already talked to you about most of them in the other slide, but that gives you a little bit more of symptoms. So, why exercise matters. Muscular dystrophy, UK, which is another article I read, says that any kind of physical activity is good for your health and well-being. It helps to maintain strength, flexibility, and independence. It improves mood, reduces stiffness, boosts energy levels, and some examples that you should be doing are stretching, swimming if you can, walking, or gentle yoga. These are some things that you can start slow and then slowly progress on, like gentle yoga and walking are two of the easiest things that you do in your daily life, so you can add on to them as you go. And so like swimming and stretching is huge every day. It can help prevent joint stiffness, which is another symptom that we talked about that comes later on with muscular dystrophy, and it supports heart health and maintain mobility. Those are all like the big problems with muscular dystrophy, like the joint stiffness, heart health, and just the mobility as a whole. So exercise is helping all of them. Small daily sessions make a big difference over time. And then in the article, it also says doing what you can will be helpful than not at all. So doing exercise at all will add up over time, and you'll be able to see some changes. How exercise response differ. You often fatigue faster, less strength, slower recovery than healthy people. Muscles are also more prone to damage and soreness. If they're weak, they're going to break, bend, they're going to do everything easier. And high intensity or long workouts can worsen weakness. So you're going to want to really look at the last point. Listen to your body. It is essential. If your body's telling you to stop or you're experiencing pain, there are other types of workouts you can do, or less strenuous workouts that you can do. Like if you're swimming, you can like stick to walking, but water workouts are huge. And then the recovery may take several hours to even a day, so you might not be working out as much as a normal person without muscular dystrophy. You're also going to want to do exercise modifications. You're going to want to do low impact, which is walking, cycling, swimming, chairs, no weightlifting or any of this. I work at a PT clinic, and some people do come in with muscular dystrophy, so we really try to keep them on like bands, or we'll have them do like sit to stands if they have trouble. And then once they're comfortable without a chair behind them, we'll have them hold onto a wall and slowly do like air squats or calf raises, just body movements or cables, no like weightlifting or any of that. And then you're going to want to avoid heavy weights, like I just said, high resistance or explosive movements, so they're all like slow ones. You're going to want to do moderate intensity, and like back to the talk test, you're going to want to be able to carry a conversation. You're going to take frequent breaks, and pacing is important. Water exercises also are very important because they reduce joint stress. Water exercises are huge, even in like a normal person's daily life. And warm-ups and cool-downs can prevent injuries. You're going to also want to adapt exercises to individual limits and comforts. And the article also emphasizes pacing and resting as needed. So also back to the PT clinic that I work at, we'll usually have them take not normally 30 seconds. We'll have them take like a minute or 2 to 3 minutes, get some water and relax, because usually their bones get weaker quicker, so they need more rest. Some medications are prednisone. It slows muscle loss, may cause weight gain, bone weakness, and mood changes. Also, ACE inhibitors, which we learn about all the time in class, helps to manage heart problems, because with this, it can affect your heart. We talked about it, so ACE inhibitors help to kind of balance that out. And the Mayo Clinic article also says that it can reduce the efficiency of the heart muscle. It can also measure intensity by perceived effort, not just heart rate, which is the RPE scale, which we talked about. It's anywhere, like it's usually 1 to 10, and then they can tell us how much it is. So it's really just by what the patient is feeling. And then exercise programs may need adjustment based on medication side effects. Healthcare providers also help to ensure safety, which is the therapist or the family members or any of them, to really watch them and make sure nothing goes wrong. I also found in my research that low to moderate intensity exercise is beneficial. Overwork weakness, too much exercise damages muscles. Consistency is better than intensity, and gentle, regular activity maintains mobility, flexibility, and independence. And then there's also mental benefits. It can reduce stress, improve mood, and build confidence. So let's see what we're going to do. We're going to do aerobic workouts, which is walking, swimming, cycling, which is 3 to 5 times a week at a moderate rate. Strength workouts like light weights, bands, mainly like I talked about, or body weight 2 to 3 times a week. Or we'll do flexibility like daily stretching for range of motion, balance, one leg stands, or calm and gentle yoga, or maybe like air squats or some sort of along the lines of that. Yeah. Break sessions into around 5 or 10 minutes if you need, and track fatigue, soreness, and daily activities. Also, gradually increase intensity and duration as tolerated, and don't overexert yourself. You want to make sure you exercise safely. Talked about this. Start slow, increase gradually, take the amount of rest, work out with PTs or healthcare providers so they can definitely see what you're doing. And if you feel any pain, soreness for around, you're just going to want to make sure you don't work out if you feel pain or soreness 24 to 48 hours before, and then after you're going to want to monitor it. And then small daily activities and occasional, maybe intense workout with bands, but you're going to want to really start slow. And then listen to your body. If it's telling you to stop, then stop. Overall, muscular dystrophy causes progressive muscle weakness. Mayo Clinic says that treatments help manage symptoms and slow the course of the disease. Exercise keeps people active, maintains function, and improves quality of life. Small daily efforts add up to long-term independence and well-being. And with the right plan, people can maintain mobility and enjoy daily life. Safe, consistent exercise is the most effective way to protect muscles and joints. Also, going back to this, what was I going to say? With the walking and the swimming and cycling, you're going to want to not do as much because you're going to tense up and get sore as quick. So overall, just build up off of that and slowly increase, even just walking, not even like with the weights and stuff. Slowly increase walking, slowly increase swimming, and you'll get to a point where you want to be. Thank you.